I'm Margery Eagan on the other half of Eagan and Braude on Boston Public Radio, and we're thrilled to be here tonight. We're thrilled for all the nice things people have said about us. I'm a little intimidated because I've met a lot of scientists tonight, and I was kind of, one of those physics for poets people in college. I don't know anything about science. But last Saturday, I guess it was 2 Saturdays ago, I downloaded the Detox Me app onto my phone and read all this stuff, and I thought, well, okay. I decided to condition my hair with olive oil, and I did it, and I spent 2 hours sitting around with the olive oil in my hair, and I smelled a little like, a pasta bowl or maybe spaghetti sauce, but the truth is, when I washed my hair out, it felt really pretty good. It felt really soft, and I was all enthusiastic, and I didn't use those nasty chemical-laden conditioners I usually do, and I thought, well, this stuff really works, and I can't tell you how much, being the physics for poet person that I am, I have learned in these last couple of weeks preparing for being here tonight about the relationship to health in general and breast cancer in particular of chemicals, and I feel really guilty about this. I kind of cringe because I've got 3 kids and they're all grown up now, and I realize that I'm their mother, and I doused them with chemicals for all those years when we were living at home. But as Patty said before, I think a lot of people just have no idea. I've been a reporter all my life. I had no idea of the notion that things are sold on the shelves at CVS or the supermarket or even at Whole Foods, and you don't know that they're safe because nobody's really tested them. So thanks to the work that people do at Silent Spring, I know a lot better now. I had to reshape my life. I realize now that my $1,500 Sleep Number bed mattress is out to get me. I'm really a little worried about that because that was pretty expensive and I just bought it. But I have got the vinegar and I have got the Castile soap going, and I've done the mashed avocado conditioning as well, and I've ditched the scented dryer sheets. I'm really torn about ditching my scented candles because I really like them. But I think I'm going to have to do it. And I'm much more aware now of all the flammable materials in my house, the furniture. But the thing of it is, I'm really grateful to be here tonight. I'm grateful to have learned as much as I've learned, because I don't say this to my 33-year-old daughter, but I'm hoping that we have some grandchildren here soon, and I can pass along the information that I've learned to her, my other kids, and to my future grandchildren. Okay, let's introduce the panel. Ruthann Rudel is the Director of Research at Silent Spring, where she leads the Institute's Chemical Exposure and Toxicology Research Programs, focusing on endocrine disrupting, you have to be able to see this, chemicals and the mechanisms by which chemicals in our everyday environment increase breast cancer risk. She's currently a member of the Environmental Protection Association's Science Advisory Committee on Chemicals.
Tamarra James-Todd, who would be sitting next to me, hi there, how are you, is the Mark and Kathryn Winkler Assistant Professor of Reproductive Perinatal Epidemiology at the Harvard T.H. Chan School of Public Health. Her research, that was not for T.H. Chan, that was for you, I want to make that clear. He's been very generous. Her research centers on environmental health and reproductive epidemiology with a focus on women's health and health disparities. She's currently serving on the National Academies of Sciences, Engineering, and Medicine's Committee on Gulf War and Health. Welcome.
And right next to me, Elisa J. Goodwin Robbins is a registered architect at Kalin Associates based in Newton. She has more than 20 years experience in architectural specifications, a focus on sustainable design and building technology. She works to educate other architects and designers on how and why to avoid toxic chemicals in our built environment. So let's start by asking what motivated you all to get into this work. Was there an aha moment? Let's start with you, Ruthann.
Well, I was actually back in the 90s, I worked for chemical companies trying to do science, learning how to do science to defend their own products, to minimize their liabilities. And I thought, well, this is interesting. And and I see a lot of industry scientists, and I see some government scientists, but where are the public health scientists in this room? I don't really see any of them. And so the reason there weren't any really is there aren't that many jobs to do that kind of science. But when as soon as I heard about Silent Spring, I came running, and that's what we do at Silent Spring. So.
Lisa, I understand what motivated you is running into Ruthann at the pool.
Yes, because you meet all the best people at the swimming pool.
And that's right.
And so I started listening to what Ruthann does for work, and I said, well, I really need you to come speak to a bunch of architects, because nothing livens up an architects conference by having slides of urine samples up on the screen.
But what about this Living Building Challenge? Tell people about that.
So it came from the Pacific Northwest, started by the International Living Futures Institute, and the Living Building Challenge was the first building certification program to try to incorporate healthy building materials and human health into our projects. And we actually have a cluster of 4 in Western Massachusetts.
And Tamarra, before we move on, I read where you noticed a early puberty problem, particularly among Black little girls. Tell us about that.
Right. So I too got inspired to start this line of research looking at environmental health disparities, specifically focused around hair product use and chemicals in hair products that more Black women and girls use. And perhaps that was, really what we're seeing as far as the disparity around puberty, which is a risk factor for breast cancer. And that inspiration came from a former professor of mine, Nancy Maxwell, who at the time I was working with Silent Spring Institute. So that's how I had kind of my aha moment.
My aha moment was when I met Ruthann too, by the way. It just occurred to me in the green room at WGBH. I for one am sick of losing. So I know there've been a lot of victory, in everything. And I know there've been a lot of victories. So can we go down the line this way? Talk about a success story that can inspire people to think how much more is actually possible. Can we start here and go down?
Sure. So
Don't be modest, by the way, either, okay?
So when you say success story, do you mean a success story from our own work or the work that others like Silent Spring Institute
Well,
are
I would
doing?
love if it had a Silent Spring connection, but anything that's related to the cause, I think people would like to hear about.
Sure. So I'm going to also highlight some of the work that Jessica Helm did with respect to Black hair care products. And one of the things that has grown out of an increased awareness around this is the synergy that's happening currently in the writing of a bill, the Personal Care Product and Safety Act, which in part, one of the things that they did in writing the bill is actually integrate in a sociologist to really think about not just the questions of how do we reduce exposure, but why do people use the products they use? If you don't provide safe alternatives, then what? Then so what? And I love that this area of research is starting to integrate both the sociological components and the environmental components and join that together.
Ruthann.
I think the work around getting flame retardants out of furniture that's in people's homes. Flame retardants are really like a poster child for companies putting, I think, the worst chemicals you can possibly think of that anybody would have known was a bad idea to put in your furniture, into your furniture. And it just makes it obvious that they don't have any kind of incentive to not do that, basically. And so they substituted a carcinogen for a neurotoxin, and then more worse substitutions after that. So what we did is we started by documenting. We measured flame retardants in people's homes and people's bodies. We showed that when you had certain kinds of flame retardant, fire safety regulations that required a lot of use of flame retardants, that you would have higher exposures. People in California, we found, have double the blood levels of PBDE flame retardants as the rest of the U.S. because they had a particular standard. And with other allies, our science and the science of others, and advocates and lawyers and journalists at the Chicago Tribune, and it took really many, many, many people, and we've changed the standards in California, we've changed the standards in Boston, and recently we've got a sort of precedent-setting decision by the Consumer Product Safety Commission to consider flame retardants in consumer products as a class, consider all the organohalogens as bad and ban them without having to go chemical by chemical.
Can I, Lisa, before you go, Margery and I were talking on the way over, we were on the phone, talking about how perverse it is. We're a little bit older than you, needless to say, and how we would search out any product that was flame retardant. And while I was saying, a couple of weeks ago, we had Bill McKibben on with us. Everybody knows who Bill McKibben is. And then Maura Healey on the same topic shortly thereafter. And they were talking about a lawsuit they were both involved in against the oil companies, saying that they knew exactly what the impact of fossil fuel would be, despite the lying. I guess where I'm going is, did the companies that were manufacturing this flame retardant stuff know then, when they were marketing to us, what you know now?
Yes, I think they did.
They did it anyway?
Yes. The carcinogen that they put in 2003 into furniture to replace the neurotoxic PBDEs that got banned in Europe, not in the US, that chemical was taken out of kids' pajamas in the 70s because it's carcinogenic. So they knew.
Lisa, I'm sorry.
Actually, I wanted to pile on to the flame retardant story because it's such a good story. And one of the pushbacks I often get from architects and building owners is like, oh, it costs too much, forget it. And one of the real success stories from getting the flame retardants out of furniture came to us from Partners Healthcare. This is a statistic from Monica Nikilski, who's I think is in the room, who's now at Blue Cross Blue Shield. And in the first 6 months of Partners Healthcare not buying furniture that did not have chemical flame retardants in it, they saved $600,000.
Wow.
So I assume, but correct me if I'm wrong, that if you go out to buy pajamas now for children, what is the situation with the flame retardants?
You buy 100% cotton pajamas.
Tight fitting.
Okay.
Yep.
But can you still buy flame retardant pajamas? You can.
They don't have the same chemical that got banned in the 70s. They have something else.
So why aren't we suing them? Why aren't we suing these people? If they knowingly did what marketed to us, things they knew were bad for our health and our kids' health, why aren't we suing them? Sort of like the tobacco suits and the suit I mentioned a minute ago. Is that something being contemplated?
Now we have to get the lawyer up here. Come on, Sean.
Because in the United States, we're protected by litigation. You have to have a one-to-one, something like asbestos, where you were exposed to the fiber and you got a disease, and then there's litigation later. But do we really need to wait for all these people's lives to be ruined?
Well, the thing that dawns on me, and I'm sure it dawns on you too, that here we are both, I've been a reporter all my life, you've been in the news business for a long time. I didn't know any of this stuff. So obviously there's a big barrier that prevents getting all the science turned into action or turned into knowledge. So no doubt the media is at fault there. I think we're at fault about everything, I guess, aren't we?
But what is the biggest barrier? I mean, what is the science. Margery and I learned so much from you guys, literally in just the few weeks we've known you all, and it's so basic. And how many times do we turn to each other when we're reading this stuff, you and I, either on the phone or at work, and say, how do we not know this? How do we not know this?
I know.
So the question is, how do we not know this? Why don't, not just us, the generic us, why don't we know this? Ruthann, you want to go first?
I mean, thinking about the chemicals that we know very well, lead, mercury, asbestos, even those things are still plaguing us. We haven't been able to sue the manufacturers who put lead paint in to homes knowing that it was going to poison kids. We haven't been able to even ban asbestos, so we can't get mercury restricted. So there's a lot of resistance. One thing with environment is It's sometimes it's hard to make a direct connection between an exposure and an individual person who was harmed. Our legal system is sort of like built on that, and so when you don't have that, you need actually I guess you need a legal, like a, what do you call it, a legislative like basis for that.
Yeah, but you get a legislative basis when people demand legislators stand up to these big companies. Yeah. And I would bet if we stopped 100 people in the street, that most of them would be as ill-informed as Margery and I were a month ago. So is it our failure? Again, not us, us personally too. Is it our failure? Is it the failure of your community to translate this stuff into accessible language for us to be able to market it? I mean, where's the breakdown along the way,
well, we're doing this. Like, we're talking to more and more people all the time, and I'm really trying to get architects to think about it. Most architects, unlike other artists, architects don't really understand their materials as much. So I'm trying to explain to people, and some of the firms who've taken on the Living Building Challenge have really been transformed by it. There's a firm I work with in Cambridge, Brunner Cott, who did a project at Hampshire College called the Kern Center. And it came into their office at a critical point where they were having a transition of ownership, and it really transformed the way they think about building materials. And it's made a huge difference to all of them. And we keep going and telling other people about it, and it won an American Institute of Architects Top 10 award last year. And we're really trying to just talk to more people about it and explain what's going on.
Some of the things that Lisa's doing that I think are also really important is to make it easier for practitioners like architects to know what decisions to make, basically. So they can't call their scientist every time they need to buy, and order some new piece.
Although I do. Yeah, but a lot of it is counterintuitive. Like, don't you want flame retardants in your furniture, right?
Or, don't you want antimicrobials?
Right. Doesn't that make you safer? And actually, it doesn't. But I needed to meet a whole bunch of scientists to figure that out.
Tamarra, do you have a thought about what's the barrier? What's the problem? Yeah.
I mean, I think the other issue is, and Ruthann brings up an important point. The practitioners are not, just the architects, but it's also thinking about when we're talking about health. Who do you all trust? You trust your doctors. And the reality is that in our current medical school curriculum, environmental health is not a topic that is covered as far as an actual course. And so oftentimes, and I work in a clinical setting in which I'm recruiting women to try to look at the role of environmental factors as it relates to women's health outcomes. Physicians simply don't know how to counsel women, say in the context of pregnancy or beyond, around, well, should I use hair dye? Should I perm my hair? Should I use perfume? They're not aware of what the chemical exposures are and what the potential health implications are with respect to this. So we have to do a better job of educating the kind of key stakeholders within our community and our society.
I speak to a lot of medical groups, and what I often say in the opening of my thing, because a lot of them have contempt for us as the vehicle for communicating or not communicating critical information. And what I say, which sounds arrogant, but Margery knows it's true, Margery and I speak to more of your patients in one day than you may speak to in a lifetime. And that's not an arrogant statement. We can have 75,000 people listening to the show. That's it's a big deal. And I'm thinking, my guess is, and we're going to have some of you on with us to talk about this soon, but I'm thinking, whenever we talk about something that's good for people, the response we often get from callers is, I know that's good, or I just heard and learned it was good, but I'm sure it's more expensive. And when I was thinking that thought, I don't know if any of you remember Debbie Weinstein, who was the head of the Mass Human Services Coalition for years. She's now in Washington. She ran a brilliant campaign 25 years ago. She wanted the state to fund something as basic as winter coats, I think it was, for low-income people, and believe it or not, they weren't doing it. And since she was failing year after year, she decided a new angle, which was the economic angle. She got all these small business owners that sold clothes to embrace the campaign, saying, they didn't say it literally, even if you don't care about poor people, if you care about small businesses, it's good for the economy. So I guess in a roundabout way I'm going, is part of the obstacle also that when people learn, they think that good things and healthier things are likely to cost more than bad? I mean, do you encounter that kind of problem?
Absolutely. When we reached out to some key companies that you all would be familiar with to ask about would they be interested in creating safe products, particularly in the space of products that would be marketed to Black women. The very first statement back was, well, it'll be too expensive, and we don't want to create these product lines that won't be purchased by communities that we don't think will be able to afford that, which seems completely not legitimate in any way.
Why doesn't it seem like if I have fewer chemicals in my product, why wouldn't it cost less?
It will be cheaper. And frankly, it's a $400 billion industry. You know, this is a huge opportunity to make money. Women care about their hair, they care about their skin, and frankly, I think it's a missed opportunity for those particular companies. So yes.
But you know, one of the things I think is the problem with the trust issue and the media is health studies that come out. Oh, butter's terrible, go to margarine. Then 15 years later, oh no, margarine's full of trans fats, whatever it's full of, go back to butter. Or coffee's going to kill you, coffee's not. You get aluminum in your deodorant, that's going to give you Alzheimer's. Well, maybe it's not. And I think that's part of the problem when the press steps in. It's a constant, yeah, it's terrible, then 2 years later, no, it's not. So I think people are confused.
Well, I think what I've learned from hanging around with Silent Spring a lot is that it's not that cut and dried. It's not what you're doing if you have more exposure to these chemicals, you're increasing your risk.
Yeah.
And it's not one-to-one. So that can be complicated. The world is complicated.
It's just like climate change, right?
Right.
Yeah.
Yeah.
It's a hoax, by the way, so don't worry about it.
Chinese hoax. Yeah. Okay.
Can we, I promised that we were going to get some members of the audience, if you were dying to ask a question, do it. Can we take a minute if you have a question for any of these three fine souls, or even maybe one for me and Margery about the media? Could you tell us who you are, please, when you stand up and then ask your question, if you would? Hi.
Hi, yes, my name is Sarah Devan. So I actually have a question for Jim and Margery.
Oh.
I'm wondering, how do you report on bad news, of which we know there's no shortage these days, in a way that keeps people engaged, that doesn't leave them feeling hopeless, or even worse, indifferent?
That's a wonderful question, actually, because we think about it, even though it's not clear that we do based on our answers, but we do think about it, maybe not in that way. One, we try to infect almost anything with humor if we can. And if it's death and destruction, we're not going to try to be funny. But that's how people talk. The goal, there are two kinds of talk radio. There's performance talk radio, where someone like Rush Limbaugh, and I'm sure, don't boo or something, he's an artist. He could talk for 10 hours without one phone call, without a guest. It's an art. We couldn't do that for 10 minutes. We have conversational talk radio. Our goal on a good day is to make you feel like you're sitting at a table with us or a bar and having a conversation about something you care about. So the first answer to your question is humor, where you can, because it breaks the tension. But the second and much more important one is to provide a forum for people to be able to speak, or hear people that have the same fears they do able to speak. And even if we don't have solutions, and believe me, we have solutions for almost nothing, just having a place where people can go. I can't tell you how many people tell us when they meet us, we feel like we know you. And that's the highest compliment, because we try to create an environment where people feel, even if you never call the show, that it's a place where people like you can be respectfully heard. And so that, I think, is the goal. And I think being heard alone often provides hope, even in the most hopeless of situations. Is that sort of answer? Okay. Anybody else?
Hi. My name's Lindsay Pike. I actually work in an architect's office in Newton. So I'm concerned about products that we recommend in interiors and in residential homes that claim to be green, but I'm concerned they might not be, like spray and foam insulation I worry about a lot, and I'd like your comments on that. And things like green fabric protection that or rug protection, I look on websites and read, and it doesn't sound very green to me. And this question could be extended to other panel members also about things that are marketed as green that really aren't. And how do we find that out?
It's really hard to find information. There are places that as architects we look online for information. I'm very hot on the Mindful Materials website right now. I don't think there's any surface treatment, stain repellent, water repellent at all that's safe, is there?
I don't think so right at this point in time.
My best advice is don't pick white carpet.
And you, yeah. But you're also working on this cool thing that's going to make it easier for you, I think.
Yes, but we are making a lot of progress through some of the Living Building Challenge projects and some projects with Harvard. We've been putting more pressure on manufacturers to make better products. And for instance, for paint, if you wanted to paint your house this week, Benjamin Moore and Sherwin-Williams both have just pushed two lines forward that are completely clear of red-list chemicals, according to the Living Building Challenge.
By the way, we have, even though I know nothing about the subject matter, we have the guys from This Old House on our show once a month. And we were talking to Kevin O'Connell, who's the host of the show last week. In fact, a caller called about environmental questions. They're spending a lot of time on these kinds of issues, trying to build and use materials that are as environmentally friendly. And they've got an audience, you should be in touch with them actually. They have an audience that is, as you know, nationwide and huge. So.
Well, especially when they talk about these airtight houses,
Yeah.
building houses that no fresh air is coming into. Well, they have this elaborate system that pumps it through, but I've always thought that was really creepy about how we can't open the windows in most buildings anymore. You know, we're in that studio of ours, that little tiny studio with the windows and the dead air, and it's a wonder we don't have all sorts of diseases.
But this gets back to collaboration. And the Harvard Office for Sustainability, the Harvard School of Public Health, and Silent Spring did a dorm study together about what kind of chemicals were in the dorms at Harvard. And you guys did it at a couple other schools too, I think. And then studied what the students brought in later. And that's something that we can all really make a difference in, what you bring home.
Do you want to add something, Tamarra, or should we're going to take one final, do you want to?
I'll just make mention that the same issue is occurring in the personal care product space, right? Like you go into stores and you kind of feel a little bit more comfortable if it says, ooh, it's phthalate free. They just kind of played a game of whack-a-mole with you because they just replaced it with something else. So, you know, just kind of being aware that whether it says that or if it happens to be more expensive, as you mentioned, it doesn't necessarily mean that it's natural or safe.
Well, you know, I'm so glad you mentioned that because a lot of L'Oreal shampoo will say paraben-free. I'm not even sure what parabens are, but you buy that thinking, oh, well, this is paraben-free. And, I mean, because most of us are really ignorant about this stuff.
Well, that's the thing. The marketing works both ways. So if you say it's antimicrobial, then we think, oh, that's a good thing, right? So I should buy that. But if it says, oh, it's paraben-free, well, then that's a good thing. And so we're, I don't know, we're being marketed to quite a bit, I guess. And yeah, go ahead.
No, it's okay.
The Detox Me app has sort of where we've taken all the research we've done on exposures and tried to put it into one package that everybody might find something that they can use.
It's great. I love it.
I just realized I can't believe I didn't think of this tonight as I'm preparing to come here. Two of my camera guys were asking me where I was going, and I said where I was going, and I was describing the thing. I forgot this. Thank you very much, got two of them to download the app while we were taping. I just realized. Thank you, Jim.
Well, one of the things that, and this sort of relates to how much evidence, or what do doctors know, and does it matter, and the different, well, butter's bad, then butter's good, and is that we aren't going to have certainty for the most part about exposure and effect and how much is safe. But I'm sort of equating it now with the pedometers that people are wearing to stay, to get their 10,000 steps a day. And this is, so each thing that you do to try to reduce your exposures is just like a few of those steps. Now, you don't know which of your steps is the one that's going to prevent you from having the heart attack. but somewhere along the line, you know, one of them is. And
We have time. One more question from the audience. Rachel, you're the decision maker here. Hi. Can you tell us who you are?
Hi. Ooh.
Hi.
My name's Nicole Stanley. I'm a firefighter lieutenant paramedic at Mashpee Fire Department.
Whoa.
I can go into burning buildings, but speaking in front of all these people is scaring the heck out of me. I just want to thank you all in this room right now. Because of you, the presumption bill was passed on July 24th, and I was diagnosed on August 21st with bilateral breast cancer. No history in my family. It is taking me by surprise, and it's slowing my life down just a little bit. I need to get on my Harley Davidson and get out of here. I'm only 3 treatments in. I've got a long road to go. I think my question to everyone here is, how do we get the information that you all have? Because of your research, I am now covered. I am on 111F. I'm not using my sick leave. My town has supported me. My town manager hugged me like a daughter and says, "We've got your back. No one fights alone." And I am extremely grateful because there are firefighters out there. There is a female firefighter in Worcester that is not getting the support that I'm getting. And there's too many misconceptions of what causes breast cancer and what causes reproductive cancer. And even my oncologist just trying to tell me smoking has nothing to do with cancer and breast cancer. I'm like, excuse me? So we need to try to find out how we can pass this information along, because the information that we have is for firefighters is always been the lung and heart bill. And it was an addendum that was added because breast cancer and reproductive organ cancer was not on the original bill. And because of this gentleman here and many people in the legislation fought to add that to the bill, and I am extremely grateful. So, thank you.
Thank you. Any of you want to? Yes, please, Ruthann.
Yeah, thank you so much for saying that. And I don't know, unfortunately, your rank, but Firefighter O'Reilly for coming to us to get help with this, and Kathryn Rogers for writing the memo. We're all the staff at Silent Spring are really busy all the time, and we get things come in the door like, do we want to comment on California's listing of spray foam insulation on the Safer Consumer Products Bill? You know, can we help the firefighters get breast cancer covered as a work-related fire? And then someone has to step up and say, you know, yes, I can do that while I'm like nursing my newborn and trying to entertain my 4-year-old. And so, in this particular case, Kathryn put together the letter, and we are working on a few projects actually now involving firefighter exposures. We're doing biomonitoring and women firefighters. So we've accumulated information, and health studies haven't been done in women firefighters because there haven't been very many women firefighters to study. But we do know that that a lot of the chemicals that firefighters are exposed to are likely to cause breast cancer, and so we put that information together, and that was enough to push it over the line and get women's cancers included in work coverage.
Thank you.
Now?
I think, by the way, we want to move on because we want to get you home, but can you please join us in thanking Tamarra, Lisa, and Ruthann for their wonderful contribution. Thank you all. Tamarra, it's good to meet you. Thank you. Ruthann, thanks. Great. Lisa, very much. We want to thank everybody for supporting this incredible cause. If you haven't donated, please consider filling an amount at the top of the sheet and handing it in on the way out the door. Before Margery says one final thing, I want to say we've worked with a lot of organizations and a lot of people in preparing for events. Our people here have been Ruthann and Rachel and Alex. We have never worked with people who have better prepared us to do the job we tried to do tonight. So we want to thank them, and we hope you will too.
And all I want to add is it was a real honor to be part of this event tonight, and I feel like I've learned so much. And as Jim said, we are communicators, and so the fact that we've learned these things will enable us to communicate this to our listeners and to have people from Silent Spring come on and talk to our listeners about this very important stuff. So thank you very much. An honor to be here. It was a wonderful evening. And thank you for all your contributions and generosity.
And support this group, not this one night a year. If you care about this, you support it financially and with your time 365 days a year. Thank you, everybody. Really appreciate it.